we have got our panelists over here, okay? And if you have loved their sessions, because I'm going to get you on stage now, and if you want to speak, please raise your hands. I'm going to bring you on stage. Talk to the panelist yourself. Tell how the sessions were. Let me know. Anybody who would like to just come on the stage, I can bring you on stage. You want to speak? Yeah. I can
I'll
see
just
Naveen.
unmute myself and say, since I'm already on there on the panel, so I'll just share something.
I would want, just hold on, please. Actually, on a, hold on. It's Mamta, right? Okay, I'm just going to put you on the spotlight. Yes. And Naveen ji, I have promoted you as a panelist. Please join in. Yes, Dr. Mamta. Yes, go ahead, please.
So this is just an experience sharing. I've been knowing about this through Ozone Group, but never, I was on the fringe of it. Been seeing the messages, never actually delved into it. It was just suddenly one fine day I was browsing through my Facebook and I saw Dr. Amitabh Banerjee's thing that he's going to speak, and I just extemporally registered for it. And I'm just in that. I was not free. I was attending my clinic, and in the meantime, my iPad was going on, and like it was multitasking, but it was a fabulous experience, especially Dr. Garg, then Dr. Kadambi. It was a very beautiful session in the morning, and how Dr. Musa explained about the methylation. Like, if I summarize in one sentence, it was or rather it is a leap into future with functional medicine with back to basics of biochemistry. Thank you so much.
Thank you. Thank you so much for those words, Dr. Mamta. I'm pretty sure so many people resonate with what you have said. Thank you so much. I'm just going to put you off the stage. With that, I think somebody had joined in. Abira Ghosh, could you please switch on your video?
Sure.
Abira. Yeah, just hold on a minute. Let me bring you on stage, please. Abira, welcome to the stage. Yes, you are. Digaj ke saath hain aap. Boliye.
Ji, and I'm feeling very much humbled. I can't say that what I am doing, it's a very little job, like a medical communicator and a writer. So I wanted to attend this conference, and more than I anticipated, I am just here. I cannot say in words, though I play with words only, but words are very much, I can say very little. So I'm thankful and grateful for all of you, like whatever I learned. And let me share a little bit what I have gone through today, especially the last part and all. So I had an interest in oncology, and I had done little bit, very little bit. I keep learning. I'm 52 years old. I have a 20-year-old daughter, and with this, I want to say, last 10 years, I am a diabetic, but I don't want to remember that. Rather, I stepped up as a to take my steps with my doctors or whatever I get from you. As now also I got many tips and turns, like how to lead your life and positively without anything artificial. So I'm here now, and I want to enhance that. Whatever life I have ahead, I just want to work. I'm studying also again. So like as a medical writer, it is okay. I want to do more. And also I want to do my PhD, which I wanted to do, but not for the very big, large scale, something to show up. I think I am very much non-diabetic that way. So I want to keep it like that. And also I wanted to put in with some patients awareness. That was my aim to come here, so that I can learn and take back. People are there out there who don't know how to actually gather and collect and put the nutrients. They don't understand, the layman. So sometimes we need to learn ourselves to go out there without the technical terms. So I'm very much grateful again. Okay, thank you so much. I would love to be again in the conference again to learn something new.
Thank you. Thank you so much, Abira. That was really nice. And definitely a lot of participants are saying the same thing as well. I'm just and put you off the stage. Thank you once again. All right. I would like to see, I could see some attendees coming in. Yes.
Naveen Kumar, AJ.
Yeah, it's can I talk?
Just a minute, please. Let me see. Where are you? Naveen. Okay, Naveen Kumar. Okay, just a minute. Let me put you on spotlight. Hello, Naveen. Very good evening.
Hello. It was a very good session. Actually, I am I myself as a patient of autoimmune disorder. And later on, I learned about the functional medicine, and also last year also I attended functional medicine conference. So it was been very helpful, and I myself cured from autoimmune disorder. I had suffered with ulcerative colitis and Crohn's. Afterwards, I started working for others, and I had got immense good result. So I had been following naturopathy and also the functional medicine. So now I am building a 100-bed nature cure center, which works on functional medicine in the outskirts of Bangalore. So it has been very useful, and just for a few hundred rupees, I would have never got this much of knowledge, especially from Mahesh ji and Ashwini ji and so many people. So it has been wealth of knowledge, and I really cannot express that in words. So it has been thanks for everyone, and thanks for arranging and for this beautiful conference. Thank you very much.
And thank you for being such a sport, such a wonderful participant, Naveen Kumar. Absolutely appreciate. A
Thank you.
weekend spent
Yes,
absolutely. बिल्कुल पैसा वसूल है.
really,
All
really.
right, all right. Thank you so much. I'm just going to put you off stage, and I can see some of the people. Okay, Dr. Kadambi, I think you're pretty much open to speaking. No problem at all. You have raised your hand. You can always unmute and say. I could see Garima.
All right. Just tell me when.
Okay, sure. So I could see Garima. Garima, I'm just gonna allow you to talk. You can speak. Some people do not want to come on the stage. Yes, you can speak, please. I've asked you to unmute. You can speak. Yes, Garima.
Yeah, thank you so much. Yeah, I'm speaking. So my journey started last year when I haven't done the FMCN course. Then Dr. Musa's course came. And, despite being master's in nutrition, my yoga certification, I never felt so understood. It is one of the most compassionate part of healing modality I have come across. All the mentors, despite their concise, precise, and, kind of strict notes, it has been a very, very motivating, inspiring, and you're really keen to understand more. So thank you so much, Dr. Mahesh, your compassion. I don't want to say, but your compassion hurts. It is so overflowing. Dr. Siddharth, I was, I had no words. Dr. Vivek, there are no words, just full of gratitude. Thank you so much for FMCN, all the functional medicine mentors, Dr. Musa, Vitavan, Dr. Siddharth's supplements, everything. Thank you so much.
Thank you, Garima. Definitely a pleasure. Thank you so much. I had the privilege to actually unmute you. Thank you so much. I could also read a wonderful comment. See, if you want to give comments, give it on that form. We sent you a form. I want to hear what you want to say because I can create a better experience for you next time. I could see that some people have given really long comments. Just copy and paste it on the form. This is what I would say. Thank you so much for the wonderful session. Anybody else? Have I missed someone? I just want to, maybe Arvind Tomar, you want to speak, I think. I have asked you to unmute. You can unmute and talk right away.
Oh, thanks
Yes.
so much. Amarjeet, thank
Arvind.
you so much. Yeah, basically, मैं बड़े लंबे time से function medicines में working हूँ and working with lots of patients also. So we do genetic studies, and after genetic study, we find the root cause and all things, and we personalize, design function medicines for particular one person. So जब मैंने ये चीज देखा तो I was shocked कि these people are working in a very well, and completely वो revised चल रहा था 2 दिन से, and it was amazing, and especially for Mr. Mahajan. Mr. Mahesh was amazing, was amazing topic as well. And Mr. Garg also. And मिथिलेशन को मैं कभी भूल नहीं सकता, तो मिथिलेशन वो बार बार रिवाइज चल रहा था डॉक्टर मूषा का, तो इट वाज अमेजिंग सेशन सीरियसली, एंड थैंक यू सो मच. लास्ट ईयर भी मैंने कुछ देखा था, बट सॉरी couldn't attend last year. So this year मैंने immediately ticket purchase किया, and then that session, it was amazing. Thank you so much, and keep working on this kind of process and help people And I'll really love to do the same thing, with my peoples also. Thank you, and changing people life. Thanks so much.
Thank you, Arvind. And yes, we are your back support to help all the functional medicine practitioners. This is the community. Yes, we are a community. We are raising the standards. We are bringing in all of these things for you. We want all of us to grow together, and that is why this is there. Thank you so much for that. And Ritu Swami, yeah.
Let Kadambi sir both.
Oh,
Thank
I'm
you.
sorry.
That's
Yes.
okay. That's okay. Once you give me the stage, sir. So, one, it's congratulations to the entire organizing team. As usual, it's been very crisp, technically perfect, amazing MC, or what do I call you? I see AJ. What does AJ mean? Is it jockey? J for jockey, and A is what?
Oh my God. Well, I'm a functional medicine coach myself. And
Okay.
in fact, my first client was Ajay. And he said that I can't remember your name. It's very long name. And then he said,
Okay.
okay, I'm Ajay, you are AJ. Since then I said, oh
Oh,
yeah, this clicks. Okay.
oh, I thought that was like, RJ, and there's a new term, ZJ or something, Zoom jockey or whatever. But I mean, that
Definitely. I look like one as when I know
you do. All
about
right.
this
So,
comment.
I mean, I think enough have been said about that. In fact,
Yeah.
I didn't want to lose a minute, and I've been in touch with Renuka. Moving from, I had a 2-hour drive, so I had to move to my car. I didn't want to miss a moment, so I transferred from my laptop to my thing. And as I was driving the car, the meditation started, which was okay. I could breathe in and out and make my pelvic muscles tight. But every time I had to roll my eyes up, there was a problem when I was driving. So I came to the golf course. I saw, okay, I'm in the parking lot, and I said, let me speak from here. So yes, this has been an amazing session, and I've been getting a lot of messages, and people ask about training courses with me, which I used to conduct, and very intense training courses. But just my focus is on the hormones, and it'll take me 2 lifetimes to even master the BHRT, in my opinion. However, you have people like Dr. Mahesh, you have Musa, you have Dr. Priti, and the whole lot of things. My idea is, my advice would be to learn from the masters, their expertise. That would be my first advice. Second is, while I would conduct these courses, paid courses, I found that it was not very impactful. So what I do now is, at least one intern I take in every year to be with me, and it's totally online. So any intern that anybody expresses interest to learn, I said the best way to learn is to see me every day and see how I handle cases. So I've been seeing those messages, and therefore my teaching pattern now has been, of course, webinars such as these, and second would be to ask you to join and just be with me for a year, and you'll probably learn what you need to know about BHRT. The rest you can pick up from the masters there. I'm very honest about it. My knowledge about functional medicine outside BHRT is very poor. So therefore, I depend upon others over there. So that's all I wanted to say. And all of you have shown so much thirst, so much passion for learning. Don't let that die down. And don't worry, we all have your backs. Why I say tera hi tota kehta is, tomorrow, if you have any issues with what you practice, all you have to do is give me a phone call. I'll make sure that we are here to defend you. This is what Dr. Ashok does also in US. Defend people who can't defend themselves, because we will be in the minority. Don't worry about it. It should not scare you. You will be able to, as long as what you're doing is scientific and what you're doing is documented. That's all I have to say for all those out there. Thank you very much.
Thank you, Dr. Kadambi. And in addition to that, I would say there were two important things that I would like to highlight. The meditative session taught us that, we all have a purpose in life, and all of us come with those beautiful gifts, and we have those gifts to present. That is why we won't be a master of everything. We will definitely be a master of one important thing, and we'll give it really, really well. And I think all of us, all the people over here have a purpose in life.
Sorry to interrupt. Lovely to see names like Anjali Mukherjee, and I'm
Yeah,
sure I've
yeah,
go through
yeah.
the attendees.
Yeah.
They're amazing.
And thank you, Dr. Vivek, for all your support always. And
I would
you
want to add
really-
you. Yes.
Anjali, right?
Thank you very much,
Thank
everyone.
you, Dr. Vivek, for all your support always. And you actually give us a lot of confidence to do what we are doing.
And you keep laughing. I need to patent that, copyright that laughter of yours.
Patent it.
Thank you, Dr. Vivek. Thank you.
I will also ask two attendees. They wanted to talk. I'm just going to allow Ritu Swami Please speak. Unmute and speak, please.
Hi everyone. Very good evening.
Hello. Very good evening.
I just can't get started. I would briefly tell my experience of being a participant and a quick introduction. I'm Ritu. I'm based out of Bangalore. I'm an IT professional. I was a patient of hypothyroidism. Took up functional medicine for my curing, and I happened to chance upon Dr. Musa and got into the program he offered. From then, I'm here in this session. What I would love to mention is I'm blown away with the amount of knowledge we have here amongst the doctors who have shared so much of immense knowledge to us, and with such good sense of humor to top it, and of course the mental faculties that comes into play when somebody has to be cured. I loved knowing all of this. I think I would like to mention that whatever was taught, I, being an IT professional, could grasp to some extent. So I would say everything was very simply put as much as possible. And I think this session gives a hope that India is no more going to be just a capital of patients of certain category, but would be capital of healing to the entire world
Well
of
said.
all the various categories of diseases that we have today. I would just end with saying more power to you all and immense gratitude. It was a lovely session. I hope it won't be annual sessions going forward, but biannual sessions. Thanks a
Ritu,
ton.
such beautifully said, and I would say definitely it's the experts only who can make such a complex thing so simple. Dr. Musa is there, by the way. Dr. Musa, would you like to say a few words? Definitely, many people have been mentioning you, wanted you to be here. And sir is driving, by the way. He has just taken out his time quickly to join in. Dr.
Yeah,
Musa, please.
yeah. Thank you very much, everybody. Join a session, and it was speaker. I especially thanks every speaker for giving their valuable time and expertise for our audience. And rightly said, we're going to make functional medicine available to each and everyone. And definitely, we are trying to make a more session, interactive sessions, and more informative session for everybody. So be in touch with us, and IFM is committed to do a functional medicine education. Thank you very much once again to all the audience, all the speakers, and especially all the team members who had made this event wonderful. Thank you very
And
much.
thank you so much, Dr. Musa, for that. And yes, everyone has been asking about courses around. There are functional medicine courses, and you will get to know about all of that, which will be sent to you on emails, etc. Post this session. And I could see one more participant, I believe, who wanted to speak. Sivaram has been pretty much very, very verbal. So I want you to please unmute and please say what you want to say. You have been.
Thank you. Thank you very much.
Yes,
I'm
yes.
really, really happy. This is my third time attending IAFM's conference. I first got to hear about it when I connected to Dr. Ruhi Agarwal via LinkedIn. And she invited me to the first session in 2022. And I've been here. This is always in my year, the best spent weekend in my life. Now, these weekends are so valuable to me. And for me, it's because I'm not a clinician. I'm an engineer. But I've worked in the medical technology space for over 35 years. And I started to need to discover things about health for myself because I didn't find answers in the traditional systems. I'm from Singapore, but I moved to India many years ago and used to go to the Western markets to look for these answers from integrative medicine doctors and functional medicine practitioners there until I first discovered Ruhi. And then I was so fortunate to attend the program. And ever since, I keep talking to other people. And through you all, I've met functional medicine doctors in other countries as well, through some of the networks I've met here. So I really, really appreciate all of the information and knowledge. All of you as masters have made this complex topic so simple that somebody who's not a clinician can understand. And I really appreciate that. So much so that I feel that everything you're all saying reverberates and resonates with what I'm trying to understand and do as well. So I really, really appreciate that. So thank you all so much. Please keep up all the fantastic work. I love how you all organize these conferences. I think it's the best run conference of so many I've attended, both in mainstream allopathic medicine and in other areas as well. It's just fantastic. Thank you, thank you, thank you so much.
Thank you for being a part of the fraternity, Sivaram. And I really look forward to you also contributing because of all of that has been taught in the conference. Thank you so much for being there.
Thank you.
All right. And Pinakin, I think you wanted to talk. Please, I've unmuted you. You can unmute and speak. Yeah.
Thank you. Am I audible?
Yes, you are audible, Ms. Shah.
Yeah. Thank you so much. I would like to take only 2 minutes. I would like to thank Dr. Rish Musa and Dr. Priti very much because I've been diagnosed with MND, motor neuron disease. But मैंने MND का मतलब चेंज कर दिया. मेरे लिए MND मतलब मैं नहीं डरता MND. And that is the only reason I've been living for the last 8 years with MNDA ALS. Thank you. And Amarjit ji, आपका your enthusiasm and your attitude is very good. Thank you so much.
Thank you. Thank you so much. Please show some love. I want to see those hearts coming in for Pinakin ji. Undoubtedly. Yes.
Sorry to interrupt, but I
Yeah,
think
no, please.
his very important message was "Main nahi darta," right? And what Dr. Lodi said to us about what a cancer diagnosis does to a patient, right? The kind of fear and that whole sympathetic system overdrive that we go into. Just look at this gentleman. What an inspiration. He, with an MND diagnosis, he turns that into "Main nahi darta," and 8 years and going strong. More power to you, sir. Thank you so much for attending and thank you for speaking.
No doubt about it. Thank you for adding on to that, Mr. Mahesh Jairaman. And I could see just one more. Madhu Sharma wanted to speak. Yes, please, you can unmute and speak.
Hello, everybody. And I don't know how to start thanking everybody. It was such a pleasure. These 2 days of the weekend were such a, occupying one, engaging one that I just had to really take my phone also along, when I went to the kitchen or something in between to grab a cup of coffee or some bite of my meals. So it was fantastic, covering so many topics. And as a nutritionist, it has helped me a lot. Thanks to Dr. Priti when I first met her by chance. And after that, there's no looking back. And it was a totally new world, which I discovered just about a year back when I got introduced into this kind of a, practice. And I knew what other things are lying, which we don't know when we practice, as I have been, since almost 40 years, I've been practicing as a nutritionist in big institutes, but had never come across so many. So I have unlearned a lot of things and relearned many more things, which I feel had, they were somewhere hidden somewhere, and I don't know why we did not think of them. So much to the extent, my clients say, आप तो पहले ऐसे नहीं करते थे, आपका क्या चेंज हो गया है, आपका, the way of looking and things like that. So, and it makes a difference. And I was skeptical a bit, whether my clients, when I talk to them in that language of going to the root cause, they come to me for weight loss or for some diabetics or a problem or something, and I go into the gut. So they say, oh, how is that connected? And when I go into that, those details, sure enough, they have those details. They don't just come out because they feel it's not connected. It's in silos, So that's how when I try to convince them, and they have found results, and most of them have referred, to others also, their friends and all. But there are still another group of them who are very skeptical about this. They don't know, they feel, I don't know what I'm doing or whatever I changed. So I just leave it to them, just, show them the way that these are the options. Just as somebody said in the morning, just don't force yourself on them, give the options and let them take the call. And once they're ready to take the call, then you guide them. So that was I forgot, somebody had just mentioned in the morning. So that was a very good message. So overall, thank you, everybody. Dr. Priti, Mahesh ji, it was wonderful learning so much from you, and Dr. Kadambi and Dr. Garg, Dr. Musa. There are so many others who, on different topics. I learned so much. It was amazing, and I would love to, keep on listening and looking forward for more such sessions. Thanks a lot. And Amarji, of course, I can't leave without thanking you. I was totally floored by your capacity, and you looked, actually, I thought you were one of those RJs, but when I came to know that you're a coach, sorry for that if I don't know, but really, you are just amazing. I have no words. Thanks for being the Sutradhar in this session, and I've given the same comments on that form that you have given. So thank you once again for that, doing that excellent job of the Sutradhar, and everybody, thanks a lot. It was amazing.
Yeah, and you are amazing. I'm pretty sure the changes that you have brought in your life now are really creating amazing changes everywhere else as well for your.
Yeah, at 70 plus, I don't think I would have changed. So, and I look forward for another 10 years if I live.
Beautiful, beautiful. Thank you so much. Thank you so much. And I could also see a couple of other attendees also who wanted to speak. I would want it to be 30 seconds short, please, because we need to do the closing session. So Dia Ray, I'm just going to allow you to talk, please. Please unmute and you can speak.
Hello, doctors and organizers. Thank you so much. It was a very enlightening 2 days and very engaging. One thing, you broke all the norms of Indian meetings. Everything started and ended on time. So it is like absolutely fabulous. And I am a cancer survivor. And I wish I had come to know about all this way earlier when I was doing chemotherapy. And a lot of it actually resonated very much. And I'd like to keep it short. Something that would really help is if we could, if we could get a list of the doctors, or a place where we could find the list of the functional doctors, then that could be like across the cities. Then I could, actually share across the groups that I am a part of in, and the list of, the medicines, or the nutritions that we can take, the supplements, or if there is some pointer to that, that would be really helpful to the community as such. So if you could, somehow do, give us a link or something where we could find. But I saw when I was Googling, most of the doctors are in Delhi, some are in Bangalore, like Dr. Ashwini. But then it would help to have if there is a list. So that's the only takeaway. And thank you.
Ma'am, you can go to IAFM.in.
Yeah, thank you very much.
IAFM.in.
Okay.
Yeah, you can go to the IAFM and you can find out the member directory over there, and you can search the city wise, and we have a list over there, and
Okay,
where you get
great.
all the information over there. Thank you very much for your feedback.
Thank you.
And of course, we're going to improve our organizations, and we are committed to do that. We can do that. Thank you very much for your
Thank you so much.
Kudos to you for being the survivor. Definitely, we loved it. We're more than happy to have hosted you. Thank you so much over there, Dia. A couple of others also. I think Dr. Jyotsna wanted to speak since a long time. Just a minute. I saw that hand raising a couple of times. Dr. Jyotsna, please.
Yes. Good evening, everyone.
Very
I am
good
a
evening.
MBBS doctor, retired from the government job, and I am from a small township, about 70,000 population, and I am working there at that place for the cancer screening, and I am focusing on the diabetes. But I never knew about these things. I was just giving the screening, cancer screening, and all. So I want to organize camps, and what help I can get from you people for the community, for the society, which I can deliver to them. How can you people be helpful for me to organize some camp, or give me some advice? Because if I go in the training of this, it will take 6 months if I go for the training and all. So can you suggest something? How can you people guide me? Somebody can come, and you can have online session if I can arrange people. They may collect at some place, and some session can be there. So I want to know I just come across. I never knew about this functional medicine. I was just taking care from my own side, conducting camps and cancer awareness, and for the diabetics, I was teaching them something or the other which I was knowing. This way I was working, and
So,
it was a
Salim,
miraculous thing.
we can help you. We can help you with conducting at least online sessions. We can bring about any speaker you want, and
Okay,
we can
okay.
certainly arrange for that. And you can drop us an email or your WhatsApp number so that we can get in touch with you.
Sure, sure. Thank you. Thank you so much. Okay.
Thank you. With that, okay, I'm seeing more hands raising in, but I'm going to be closing the session. So I'm going to just take Madhu Sharma and Vijay Lakshmi last. Okay. So Madhu Sharma ji, please unmute and you can speak.
Sorry, I think it went by mistake. I probably just went by mistake.
Did you enjoy the sessions?
Yeah, definitely. I just
I think you missed the name, Amarjit ji. She is the nutritionist who's still learning at the age of 70 plus.
I think
hand wasn't raised, that's all.
And I am learning from her.
Yeah, we are all learning
No,
from her
these are my
enthusiasm.
mentors sitting here. Dr. Garg, Dr. Priti, Dr. Musa, all of them. I'm still learning. I did a course for about 3 months course, which was very useful. And that is how, I picked up and I'm into this, and I don't miss a single session that comes along. And I have integrated this functional medicine, functional nutrition, I would say, part of medicine or part of my course. So it's really wonderful. I've integrated this with nutrition.
I would want this to be muted. I'm not sure where is that. All right. With that, I would request Dr. Priti to please come on stage. I think Vijay Lakshmi wanted to talk. Vijay Lakshmi, you are last there. Please unmute and quickly. I would request you to.
Yeah, I would like to say thanks to every doctor, but especially Maheshi, because I have read so many articles about light therapy and every therapies. But the thing is, today, one takeaway point is like estrogen dominance. Even as a being a naturopath practitioner, I'm practicing every category like color therapy and every therapy. But we forgot about estrogen dominance. And thank you so much, sir, for giving a lot of knowledge, and thank to IFM for providing a vast knowledge to us. Thank you so much.
Thank you so much for that. That was Vijay Lakshmi there from the participants. Thank you so much, Mahesh Jayaramanji. I'll be just moving you from the spotlight for bringing Dr. Priti on stage. So Dr. Priti, as the president of the IAFM Society, has been rigorously working to bring the FM fraternity together. She would be extending the closing session.
Thank you, Amarjit. Thank you for doing this so beautifully. Thank you, everybody, for participating and motivating us. And thank you to all speakers. I think Dil se. You can hear me?
There is a little disturbance because of the internet. I believe you're traveling, actually. That's the reason.
Yeah.
But yes, please go ahead. Please go ahead.
Great. So thank you all the speakers, because I could see and hear ki sabne dil se whatever they know, they have shared. I have a good news for all of you. We are going to come up with a liver summit the way we did thyroid summit last year in April 2025. So please keep watching us. Subscribe to our social media channel, and do keep sharing what you are learning and what more you want to learn. Our aim at IFM is to spread education and to take functional medicine to every household. I think somebody said it so beautifully कि आज तक इंडिया को हम डायबिटीज कहते आए हैं, अब हम इंडिया को होलिस्टिक केयर कैपिटल कहने वाले हैं. I think 3 cheers for all of us who are here and all of us who have left, and we will see you very soon again with the Liver Summit. Thank you.
Thank you so much, Dr. Preeti. Thank you so much for those inspirational and motivational words. Once again, I really don't
Thank
feel
you.
like closing the session though.
I know.
But
You did it so well, Amarjit. We don't want you to close it also.
thank you for that. But yes,
Isn't there a party after this, a banquet that we have after every conference? We need to add that.
well, I think we'll do it in the sunlight, and we'll have, light
I
therapy
know.
and all the functional therapies that we have suggested. Good food, good people, good attitude, good mindset, and all of that all together. And I know that's there.
Good singing, good dancing.
Yes, singing and dancing as well. So
Yeah.
thank you once again, everyone. It has been,
Thank you, everybody. Please, thank you.
yes, it has been a fabulous 2 days. I really look forward to seeing all of you once again in another wonderful, powerful IAFM conference. Till then, I would love to wish everyone, I think it's very early, but a very, very happy new year. And you have a rocking 2025. I'll see you then. Thank you very much. It's
Thank you so
AJ
much,
signing
Amarjit,
off.
again. Everybody appreciate. We should also say, and thank you so much, Renuka, and thank you so much, Dr. Preeti, for arranging all the speakers for it. Thank you so much.
Thank you.
Thank you. Thank you. I shall be closing the session. Thank you. Happy New Year.
Bye-bye.
Bye-bye.
Thank
Bye.
you.
Bye-bye.